Welcome back to Women's Era. അങ്ങനെ നമ്മുടെ നെക്സ്റ്റ് സെഗ്മെന്റിലേക്ക് പോകാനുള്ള സമയമായിരിക്കുകയാണ്. നെക്സ്റ്റ് സെഗ്മെന്റ് എന്ന് പറയുന്നത് കെയർ ആൻഡ് ക്യൂർ ആണ്. ഇന്ന് കെയർ ആൻഡ് ക്യൂറിൽ നമ്മുടെ കൂടെ ജോയിൻ ചെയ്യുന്നത് ഡോക്ടർ സന താഹിറാണ്, GP ഡെന്റിസ്റ്റ്, സണ്ടി പുഹേര മെഡിക്കൽ സെന്റർ ഷാർജ. ഇന്ന് നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത് ഓറൽ ഹെൽത്ത് അല്ലെങ്കിൽ ഓറൽ ഹൈജീൻ എന്ന വിഷയത്തിനെ കുറിച്ചാണ്. എല്ലാവർക്കും വിളിച്ച സംശയങ്ങളെല്ലാം ക്ലിയർ ചെയ്യാവുന്നതാണ്. സോ വൺസ് അഗെയിൻ വെൽക്കം ടു കെയർ ആൻഡ് ക്യൂർ. Doctor, welcome to the show.
Thank you very much.
Let's start with the very basic question. What is the type of toothpaste we have to use, or what is the best toothbrush we have to use?
Well, toothpaste, basically you need to have a fluoridated toothpaste.
Okay.
And any basic toothpaste will do. No brand is important, and it's not that this paste is the best and this is better than the other. Any paste is good.
Okay.
It's the way you brush your teeth.
Okay.
So using a soft brush is important because many people think that if you use a hard brush,
Yes.
It cleans better.
Yeah.
It doesn't.
Okay.
The thing is not to use excessive force.
Okay.
And the key is not to brush with a lot of vigor.
Okay.
Okay? And not to use very hard bristles.
Okay.
So soft bristles are always best for brushing because you don't want to wear away the good enamel.
Okay.
You do not want to wear away the gingiva.
Okay.
So you want to be soft, gentle, at the same time cleanse the area.
Okay.
So that's basically the idea we have.
Okay.
So soft brush and medium pressure. Change the brush every 3 months. If your brush frays before 3 months, that means you're brushing with a lot of force.
Okay.
So there's something wrong there.
So that is the how we can identify. if you're,
one of the keys.
Okay.
See, nothing is set in stone.
Okay. Exactly.
Yeah. So every patient, every person is different. But these are a few kind of grand rules. You can say that, yeah.
So ideally, how much time we should brush?
2 minutes at
Not
least.
more than.
Well, you can go more
Okay.
if you're really slow, but at least 2 minutes.
Okay.
How many people brush for 2 minutes? Very few.
Very few.
I mean, if you actually sit and count, I think 10 seconds, 20 seconds, we just do it really fast. And
Really.
if you actually count, would you?
Okay.
Next time, why don't you do that? Why don't all of you do that, actually? Put a timer and count,
Okay. That's interesting.
Yeah.
I was thinking, I was thinking like, it will be like 2 or 3 minutes we are brushing, or up to 5 minutes we are brushing.
Usually, yes, some people might be doing that, but actually, if you sit and count, we don't brush for more than 30 seconds, most of us. And average, we brush for only 30 seconds, if I'm not wrong. Yeah.
Okay.
So why don't all of you do that? You people go and time not only yourself, and don't change anything.
Okay.
Time your family members, time your children, time your spouses, and see.
Okay.
It would be odd,
Okay.
It
You
would
can
not be 2
also,
minutes.
tell us about the ways, ideal ways to brush, the movements you have to
Yeah.
give.
See, usually people think horizontal motion is good.
Yeah.
But no, horizontal motion is not very, good for the gums and the teeth. It's circular, preferably circular. And when you go back, it's 45-degree angulation is good.
Okay.
So you have ideal brushing techniques on internet. You can go and have a look at it.
Okay.
Sometimes the brushing techniques vary with certain conditions, gum conditions. Then we modify the brushing techniques, but that's person to person. Ideally, it's circular motions. Yeah.
Okay. Now in the market, this battery operated brushes are available.
Yes.
How good is that?
They're good.
It's good.
They're good,
They're
yeah.
giving the correct motion.
Yeah, because they would have, most of them would be approved.
Okay.
So
We can we can
they are
follow that
good.
also.
If you are not, several times my patients, they do not have correct brushing techniques, that's when I, tell them, why don't you go ahead and try an electric brush?
Okay.
And it's fun, because
Yeah.
Yeah, I know.
Especially for kids, it's
yes, it
it's
is fun.
really
But I don't recommend for all kids because kids then get lazy.
Oh, exactly. Okay.
Yeah. So you want your child to brush their teeth, right?
Okay.
So you want them to go circular, and you teach them up and down and circular, all those motions you teach them, so that they take it forward in their life.
Okay.
But if you give them an electric brush early on, they're going to get really lazy.
Yeah, they are going to become lazy. Okay. How about this mouthwash and all? Rinsing your mouth with the mouthwash. Is it really good, or is it required really?
In a normal healthy gingiva, it is not required a mouthwash, a medicated mouthwash.
Okay.
Salt water gargling regular water gargling, just mouth gargling with water is more than enough.
Okay.
Yeah. If it is required, your dentist will tell you that. Okay. And the time for the time period for which the patient has to be using that is also told.
Okay.
But on a consistent, long-term basis, I do not recommend a mouthwash. Just go to,
any pharmacy.
a pharmacy and pick up a mouthwash because I'm having bad breath. If you're having bad breath, please go and meet your dentist, basically.
So how long can we use a mouthwash if at all we are going for that? How long can we use it?
See, it depends on the ingredients.
Okay.
If there's one ingredient called chlorhexidine,
okay.
if this ingredient is there, we don't recommend it more than 2 weeks.
Okay.
Because it has a tendency of staining the teeth.
Okay.
So basically, I recommend if the patient doesn't have a lot of problem and the patient does not require a medicated mouthwash, saltwater gargling, warm saline rinses, we call it, it's very good. Okay,
you don't
it's
have
simple.
To go for this
it's simple. It's inexpensive.
Yes.
Yeah, and you can do it at home all the time. Yeah,
Yes,
just salt and water.
Yeah, that's a good idea. You don't have to invest for mouthwash then.
Yes,
salt,
exactly.
water. And it will be a little hot. That is more better.
Warm, not hot. Warm.
That is more better.
Yeah, better. Warm is good because it will dissolve the salt. If it's cold, it's not going to dissolve the salt.
Not only that, not for the teeth.
Well, it is good to have a warm saline always. It is conducive, but yeah.
Okay, at what age do we have to introduce our kids to brushing by their own?
When all the teeth start erupting.
Okay.
They're very early on. So the first tooth probably comes at 6 months. So I would not say at 6 months the child is going to brush, but the mother has to see that whatever tooth is there in the mouth is clean. Because usually they're feeding, they're breastfeeding, they're bottle feeding. So you need to keep the teeth clean. You need to keep the tongue clean. Use a tissue or a gauze wrapped around your finger, clean the teeth.
Okay.
Nowadays, you have a lot of finger brushes.
Yeah, finger brushes are
for children, and you have flavored pastes, which are, they can be edible also.
Okay.
So, as soon as you see the first tooth, basically, you can start. You can start with oral hygiene, basically.
Okay. Coming to dental troubles, what are the early signs of dental troubles?
See, dental troubles are varied.
Okay.
Very common kind of a sign would be bleeding gums.
Okay.
Very common, young people, old people, middle-aged, everybody, comes with that, or bad breath, or probably sensitivity.
Okay.
So these are early signs, sensitivity in teeth, bleeding gums, these are early signs.
Okay,
yeah.
so bad breath is also a sign of dental problem?
One of the signs,
What causes exactly bad breath?
There are a lot of reasons. See, you can start with the simple thing like lot of deposits on the teeth, local factors. Let's go ahead with the local factors. So the local factors would be a lot of deposits on the teeth.
Okay.
This is basic. And something else like, bad breath can be varied. It can be consistent. Okay, for example, it is there even if you brush your teeth, it does not go, then there's some kind of a pathological condition with your gums. Or if it is not the teeth and the gums, then there is some kind of a systemic, as in the system there's some condition. Okay. But if it is a bad breath that comes and goes, for example, you eat something like an onion or garlic, that is also bad breath. That is temporary.
This bad breath, is it connected to any particular kind of food habits, like, or if you can say like people who drink or people who smoke, they are going to have this?
Smoking. See, when a person is smoking, they will smell of tobacco. They will smell.
Or any other food, like maybe soft drinks or something.
That does not cause bad breath. Soft drinks will not cause bad breath, but it is not good for the teeth.
Okay. What it does exactly bad for
it causes, when you drink these aerated drinks, it has a small amount of acid. If you go into the composition of soft drink or an aerated drink, which has bubbles in it, if you go into it, it has very high sugar content. It has a small amount of acid in it. So these are not good for the teeth. And then they have no nutritive value. It's just empty calories that you're taking. It's not good for the teeth. It's not good for the body.
It's not at all good for you.
It's not good.
Coming to this ice creams and chocolates and all, what are they doing bad to our teeth?
Ice cream and chocolates don't do anything bad to the teeth. It is what we do to our teeth. Okay? You can eat ice creams and chocolates. Let your children eat them. But brush their teeth after that.
Immediately.
Keep it clean. And preferably, sweets should be immediately after meals, not in between snacks. So basically, keep the mouth clean. If your child has chocolate or an ice cream, it's okay. They're growing up, they want to eat these things, but keep timings for it. I prefer that I tell my patients not to give them sweets at night, preferably. Even if you do, brush twice a day, 12 hours once, brush your teeth. Before going to bed, brush your teeth. Essential to wash away all the dirt in your mouth, gargle after every meal, keep it clean.
Okay.
Why we say, sweets or chocolates are bad, it's because of the sugar content in it.
Okay.
It is very high. Sugar is carbohydrate, very high in carbohydrate. It's sticky, it sticks to the tooth, and then the bacteria grow on it because it's sticky there, basically.
Okay. Okay, now coming to tooth decay, how can we recognize it's a tooth decay early?
Feeling would be probably sensitivity when you eat something sweet, or probably when you drink some water also, or you can see a spot sometimes. The key to early detection is always visiting a dentist at least once or twice a year.
Okay.
So oral health can be only maintained if you visit a dentist.
Okay. So you recommend once or twice in a year to visit a dentist, even if you don't have any troubles?
Yes, general health checkup.
General health.
Like you do general health checkup, why don't you do general oral checkup? We don't do that, do we?
Yeah, we don't do that.
We don't do that, only if we have pain.
Yes, people go to dentist only if you have pain. That is the problem. Then coming to this fillings and all, what is the stage or when do we have to do the fillings and all?
See, when the decay is frank, we will do a filling. Okay, we have to remove the decay. If the tooth is decayed, it is eaten away the enamel or the next layer that is the dentine, then we will do the filling. For anything, you have to visit your dentist to know how far, to what extent the filling is required.
Okay.
So basically, you'll have sensitivity. You feel anything. Anybody feels uncomfortable with the way they are eating, with the way they are feeling, visit your, doctor. Visit your dentist. Like how you feel about your body. Your mouth is like a window to your entire body.
Exactly.
Yeah. So if something is wrong with the mouth, you will feel it first. You will know it better than all of us. So if you feel something uncomfortable, visit us.
Yes. We were talking about toothpaste and fluorides and all. How good fluorides are to our teeth, or does we really require fluoride content in a toothpaste?
Basically, fluoride prevents tooth decay.
Okay.
That's why.
That's
the only reason,
Okay.
But we don't recommend very high fluoridated paste for children, because they don't need it. Fluoride, basically, that is the reason we recommend fluoridated toothpaste.
Okay, so
it's topical.
To some extent, it is.
It is good, yes, of course.
Okay, nowadays everyone is behind teeth whitening and teeth bleaching and all. How good it is this teeth whitening and bleaching?
See, I can't say it is good or bad. Okay? It is a cosmetic procedure. Okay? I can't say it is bad. I mean, it is not required. It is required only in certain cases, pathological cases. But generally, when people come for teeth whitening, it's like a cosmetic procedure. It's like skin bleaching. It's neither good or bad. It is their personal choice. It will whiten your teeth for a temporary basis, make the teeth look bright and nice and white and shiny. And if that's what they want, that's what they want.
Okay, so that is a call on that.
Yeah, that's it, yeah.
So coming to oral health and hygiene in kids, what are the ideal practices we should follow as parents?
As parents, basically, brush their teeth. Get them to brush their teeth. Brush them, make them brush twice. See to that they brush their teeth. Gargle after every meal. Avoid a lot of processed food. Processed food like biscuits and chocolates, yes. Try and avoid that. Fibrous fruits, vegetables, good for teeth, good for health, good for nutrition, overall good. So
for kids also, do we have to get for this regular checkups?
Yes.
Checkups?
Yes.
Like once in 6 months or like that?
Once in 6 months is good enough if the child does not complain much or doesn't have any tooth decay. But once in 6 months to a pediatric dentist, it's recommended.
Okay, so you have to take separate to pediatric dentist?
Yes, it's always preferred because it's another specialty.
Sometimes we take Xrays of teeth, right? What all cases are you doing that? Or what you are trying to identify?
The thing with teeth is, you've seen the tip of an iceberg? Yeah? When you're going in the ocean? Titanic.
Yes.
Okay. So you just see the tip. There's a lot of it down under.
You don't know.
We can't see that. We see what we see in our mouth is just the outer part. That is the crown, we call it.
Okay.
The roots, the bone, the gums are all inside. And if there is some kind of a pathology or some problem inside, how can we see it? We don't have X-ray vision, do we?
Yeah.
And hence we recommend X-rays.
Okay.
It's to make our diagnosis easy.
Easy. Apart from X-rays, is there any other type of scan or something to diagnose, or only X-rays for this?
X-rays, different kinds of X-rays.
Okay, that is the.
Then you go into specialized X-rays, but they are kind of X-rays itself.
Okay, okay. About this teeth fillings, I was asking that time. Do we have something that lasts long, the kind of filling that lasts long, or is it like 4 years, 5 years? How is the time period?
See, we can't give you guarantee on any product or filling.
Okay.
It is, at the end of the day, it's a product,
Okay,
right?
Okay.
And it is a cross-linked polymer,
Okay.
basically. The best in the market will be used. Excuse me.
No problem.
The best in the market will be used, but I can't tell you that it's going to last so long. I don't know what you're going to do with it. Okay.
Okay.
Tomorrow, if someone goes and eats something really hard, it can break.
Okay.
There's no guarantee on that.
Okay.
Okay. Warranty probably your respective clinics can give you, but guarantee no guarantee on these any kind of products. So you don't get a guarantee on a car. You can't get a guarantee on a filling. Now, can you?
Okay.
Yeah.
Can you just explain a little more about the types of fillings it's generally prevailing?
Well, right now we do composite fillings.
Okay.
Resin reinforced composite fillings, which are tooth color. They match the tooth color exactly. So they are the most popular kind of fillings because they match the tooth color. They are very high strength. They are good fillings as of now. Maybe market will get better fillings. There are a lot of research going on. There are other kind of older fillings like amalgam, the silver filling.
Okay.
Traditional fillings, but that's a little obsolete right now. But I'm sure there are a couple of people who still prefer that.
Okay.
So these are actually then we have glass ionomer fillings, which is also used to an extent. And then you have temporary fillings. We have different categories of fillings.
Okay.
Yeah.
Right now we can see so much of ads for smile correcting and all these things. What is it all about?
Depends. What smile correcting are we talking about here? Orthodontic correcting, or thing is everybody wants a good smile. Yeah, because everybody wants to look good. A smile is like very important for a beautiful face.
Okay.
Yeah.
So what are the procedures?
There are different procedures, and it varies from person to person.
Okay.
Requirement of the person.
Yeah.
At present, something very popular in this part of the world is Hollywood smile.
Okay.
Yeah. So it's just veneers on the front teeth.
Okay.
Bright, nice veneers and beautiful smile.
Okay.
So quite popular,
Okay.
and is done by a lot of prosthodontists.
Okay.
Yes.
Okay.
So that's popular right now.
Okay. So that is altogether a different thing.
Well, it's again, Hollywood smile is a subject in itself. Yeah.
Okay.
People come asking for it. We want Hollywood smile. So basically, it's become popular like that because you have a lot of probably Hollywood actors or female and male getting it done.
Okay. Pregnancy is a time where we'll get a lot of tooth disturbances and all. So what are the possible things happens in pregnancy with teeth?
Swelling of gums, because hormonal changes, you have swelling of feet, and because of hormonal changes there can be swelling of gums as well, and bleeding of gums. So if someone is trying to get pregnant or someone is planning a pregnancy, I always recommend them to have one round of checkup, dental checkup, a round of thorough cleaning and prophylaxis, or cleaning of teeth, prophylaxis, cleaning of teeth. Then go ahead, because they are going to usually they'll have these kind of problems, bleeding gums, and if you have local factors, it'll just get aggravated.
Okay, doctor, sorry to interrupt. We have a caller. Hello.
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 Hello. Yes.
Hello. I think.
Hello, doctor.
Hello. ആരാ സംസാരിക്കുന്ന?
എൻ്റെ പേര് റിതേഷ്.
കുറച്ച് ഉറക്കെ സംസാരിക്കോ?
എൻ്റെ പേര് റിതേഷ്. ഞാൻ ജുമൈറ
സംസാരിക്കോ?
ഹലോ.
ഹലോ.
കേൾക്കാമോ?
Ritesh, hello. Caller drop by. Some happened with the call, something. No problem, we can come back to that caller again. So we were discussing about the pregnancy related toothaches. Anything else we can expect?
Well, everything gets aggravated in pregnancy. If you have a decay, then sometime you might develop a little bit of pain. So whatever problems you have before pregnancy, please get them solved. That's what I say.
Okay. Some kind of gum swellings or something, I have read somewhere that it's a sign of early sign of pregnancy, is it?
No.
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 That is a wrong information.
No.
Okay. Okay. And again, after delivery also, is there any chances of, because of this pregnancy-related hormones, is there any chances to get any kind of dental problems or something like that?
See, they would have some kind of a pre-existing issues.
Okay.
Okay. So that pre-existing issues have not been addressed to. Pregnancy is a time when you cannot do a lot of dental procedure.
Okay.
You cannot take a lot of dental X-rays easily. You're already, you're hormonal and you can't go through a lot of procedure during that time.
Okay.
So basically, you'll have a pre-existing condition most of the time, which gets aggravated during pregnancy due to the hormonal changes, due to the compromise in the body, because there you are supplying nutrition to another human being altogether. So
okay. So that's
why.
Okay, fine. I think we have a caller. Hello.
Hello.
Hi, good afternoon. Welcome to Care and Cure. Arada.
Oh, thank you. It's Ritesh calling from Jumeirah.
Okay, Ritesh. Dr. Samsar Chodu.
Hi, doctor.
Hello.
Actually, I'm calling for my wife.
Okay.
She's 6 months pregnant right now.
Okay.
Earlier, she had a complaint about her teeth and something that doctor advised for root canal.
Okay.
I now just started pain also. So is it okay for doing now because she's pregnant?
Okay. Is it okay for her to go for a root canal?
Yeah,
because she's
in the
6 months
pregnancy period.
See, they can at least start the root canal because she has pain, right? Without an X-ray, they can start the root canal. The pain will reduce immediately.
Okay.
Okay. They can start the root canal. If you don't want to finish it, you can finish it after the delivery. That's okay. But the pain will reduce if she starts it, I'm sure, in most cases, yes. In most cases, yes.
Is there any side effect for maybe any chance of bleeding or something?
Bleeding in root canal is rare, but don't worry. The thing is, don't worry. If your dentist has told you to go for a root canal and he can manage it, trust him.
Okay.
Because if she has pain, she's going to be very uncomfortable. And the first step, the first procedure of root canal, after that she's going to feel a little more comfortable. So I think if your dentist has told that she needs a root canal, at least get the first step done, yeah.
Okay, thank you very much, Doctor.
You're welcome.
Okay, Ritesh, thank you so much. So again, we were discussing about the pregnancy topic and something related came. I think we'll just go for a short break and then we'll come back with more. Care and Cure segmental or cherry break and break ni shesham veendum കാണാം. Welcome back to Care and Cure. എൻ്റെ കൂടെയുള്ള ഡോക്ടർ സന താഹിറാണ്. നമ്മൾ ഡിസ്കസ് ചെയ്യുന്നത് ഓറൽ ഹെൽത്ത് എന്ന വിഷയത്തിനെ കുറിച്ചാണ്. ഡോക്ടർ, while coming to the teeth extraction of kids, we have a very conventional method of doing it at home. How far it is good, or do we have to take them to a dentist?
You have to take them to a dentist.
Not at all good at home.
No, definitely not. I will never recommend that. I'm a dentist myself. No, always in aseptic precautions, in a clean, hygienic clinic. Preferably with the pediatric dentist, but always in a clinic. Better in a clinic.
Okay. So you are giving the sedation and all to the kids, and only then you'll extract it? Or
we will give local anesthesia probably, yeah. If the child is uncooperative, then the pediatric dentist will decide whether the child has to be taken under general anesthesia, and there is facilities for that in different hospitals and different centers, yeah.
Oh. So it's always better to take our kids to a dentist. Don't do it at home anymore.
Please, no.
We can see in kids very commonly some kind of black dots coming on the teeth, especially when they are, exposed to a certain kind of medicines and all. So what is the reason behind it?
Certain kinds of medicines like iron, which, probably they can be just simple stains.
Okay.
Probably they'll need just a round of cleaning, usually, if they're just spots. Okay. Black spots can be decay.
Yeah.
So for anything, you have to, again,
consult a dentist.
Yes.
That is a prime thing.
Prime thing. You have your child, or we have to develop that concept of getting a general oral health checkup done. You have to get your teeth checked.
Yeah.
It's not when problem arises that you visit. Why don't we do that? We need to do that more. Prevention is better than cure.
We require a lot of awareness for this fact, I think.
Yes.
Like we were discussing, only if we get into some trouble, only then we are going to visit a dentist. Otherwise, no.
Yes. See, the thing is, preventive dentistry is very prime right now.
Okay.
Prevention is better than cure.
Okay.
Yeah. So let's prevent something from happening. For that, you need to visit us.
Okay.
Yeah.
Okay.
So let's prevent it, and then it's better.
Okay. So in this preventive dentistry, I'm hearing it for the first time now. What and all you're covering in this preventive dentistry?
Well, first of all, we'll do rounds of cleaning, and for children it is fluoride applications.
Okay.
So again, that is decided by the respective dentists, you know. But visiting is very important. So under preventive dentistry, a lot of categories fall into place. And also, it also helps us in early detection.
Okay.
So if you go to a dentist, if there's a very early decay, only dentists can detect it.
Okay.
So you can solve the problem before it gets worse.
Okay.
Correct? So you want that.
Yeah.
You don't want the trouble of going through a root canal.
Yeah.
You want a simple filling and solve the problem, right? So visit a dentist.
Okay.
It's good for you. Yeah.
Okay. This cleaning is the same like kids on this. It's okay. Cleaning is same for kids and adults. It's the same procedure.
It is called prophylaxis, and if it is done on an adult, it's called adult. If it's done on a child, it's called child.
So basically, the methodology is the same.
Well, there are minor differences that only I would know.
Okay. Okay, fine. Sometimes we can see bleeding gums in teeth of kids as well.
Yes.
What is the cause of that?
It's again local factors are the most primary factors. The presence of plaque.
Plaque. Okay.
Plaque contains bacteria.
Okay.
Bacteria causes inflammation. Inflammation is swelling of gums, and inflamed or swollen gums in turn causes bleeding. It's all a vicious circle, isn't it?
Okay. Then sometimes we have this kind of mouth ulcers. What does it really cause, the mouth ulcers?
There are different kinds of ulcers.
Okay.
Okay. If you have simple aphthous ulcers, it sometimes happens due to hormonal changes when women are on their periods.
Okay.
Hormonal changes that can cause aphthous ulcers. Sometimes ulcers due to deficiencies also can occur. Sometimes there can be traumatic ulcers. For example, there's a sharp tooth or a sharp filling or a sharp prosthesis in the mouth, and that is constantly abrading a soft surface in the mouth.
Okay.
That is called a traumatic ulcer. For anything, again, you have to get it checked.
Okay.
Okay? If it is a sharp tooth or a sharp prosthesis in the mouth, please get it checked.
Okay.
Get it solved.
Okay.
Don't let anything sharp keep abrading a soft area.
Okay.
That is not good.
We have a general practice of going to the pharmacy and taking a vitamin B complex tablet,
Yeah.
stating that that could be the reason for mouth
Yeah,
ulcer.
I have seen that. Yeah.
But not only that is the reason for
no,
mouth
there can be
ulcer.
several reasons.
Several
There can be several ulcers.
Okay. Okay.
There's an entire chapter on ulcers. So
So it's always better
yes,
to
always
consult
get the right diagnosis. That's the most important. That's the key.
Now, since we were talking about ulcers, coming to oral cancers, how common are they and how can we symptoms and all these things about oral cancer?
See, oral cancer is caused due to various causes. Okay. The thing about an oral cancer is an unhealing ulcer.
Okay.
See, ulcer.
Yeah.
Yeah. Something that is not healing consistently and persistently there.
Okay.
And it can be caused due to different things. Let's make it very simple. I don't want to scare. Smoking causes it. That's known.
Yeah,
It's written on the cigarette packet.
Yes.
People still smoke.
Yeah.
So it's like you're drinking poison, you don't mind it.
Yeah. So that is one
That's
reason.
one of the reasons. And another reason would be a sharp prosthesis or a sharp tooth, abrading a soft area consistently, constantly. Not necessary, everything will turn into cancer. Not necessary, definitely not.
Okay.
But getting yourself checked does not harm you.
Yeah.
Okay? Yeah. Solving the problem will not cause any trouble.
Okay.
It will just make your life easier, life better.
Other medical causes which cause cancer?
Cancer, there are many causes, and there aren't any causes also.
Okay.
Oral cancer most often is caused due to tobacco. tobacco usage or a sharp prosthesis, chewable forms of tobacco, gutka. But here we don't see a lot. Back home in India, you see. Buckle, when you put the tobacco in the space, the cheek. That causes. That's the commonest cause in certain countries.
Okay. Now, how is the
smoking.
treatment what all treatments and what is the fatal that stage in the...
Well, see, if we go into the details of it, then
It's scary.
it is scary. It's cancer. Okay, simple. You have to get rid of it. They dissect it out. After that, from patient to patient, spread of the cancer, depending on that, treatment plan varies.
Okay. How about the survival ratio compared to other cancers? Is it less or more?
It depends on the extent of cancer, how far it has gone, to what extent it has spread. I can't tell you exactly because it will vary from patient to patient.
Is it very common, like other cancers, what we hear today?
Well, it is common in certain countries a lot.
Okay.
Certain areas, no.
Okay.
It depends. See, local factors cause it a lot. Like a chewable form of tobacco, if in an area people constantly chew tobacco, then in that area you'll find very high incidence of oral cancer.
Okay.
Otherwise, usually if local factors are absent, very rarely, because of no reason it occurs.
Okay.
So don't smoke. No tobacco, chewable or smoking.
So your lifestyle
is
what causes all these things?
Mostly. Oral cancer. Let's be very specific. Oral cancer. Oral cancer.
So if we tell about an ideal oral hygiene practice, what we can inculcate in your kids at home itself, what are all we have to take?
Brush twice.
That's it.
Please brush twice. That will solve half your problems. Brush twice a day.
Okay.
12 hours once. Brushing is mandatory.
12 hours.
Soft brush, yes. Gargle after every meal, that's a good habit too. Do salt water gargling once a day, keeps your gums healthy. But brush your teeth.
Okay.
Keep them clean. Anything, if you keep it clean, it's going to be maintained. And visit a dentist at least every 6 months. That will solve most of your issues, won't it?
Okay. So it was nice talking to you, doctor. Thank you so much for your time.
Likewise. Thank you so much.
അങ്ങനെ നമ്മുടെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റ് ഇവിടെ അവസാനിക്കുകയാണ്. നാളെ കൂടുതൽ വിശേഷങ്ങളുമായി മറ്റൊരു വിമൻസർ എപ്പിസോഡുമായി വരുന്നവരെ ഗുഡ് ബൈ.